Hi guys, welcome to today's screencast. So we're going to continue with aerobic training. Now last week we looked at what aerobic training was, kind of VO2 max being the maximum volume of oxygen inspired, transported and utilised per minute during exhaustive exercise. We also looked at the factors which actually affect someone's aerobic capacity and the evaluation of it with regards to the different types of tests you can do with regards to aerobic training. Now on the screen you've just got here the fit principles that we should follow when you're actually looking at achieving overload within training programs. So you've got frequency of aerobic training should be a minimum of 3 times per week. You've also got the intensity should be around 60 to 80% of your target heart rate. So we looked at target heart rate zones. Within that we looked at Carbona's principle, which was training heart rate equals resting heart rate plus percentage of training zone. If you want to be training at 60% of your heart rate max, and then you've got in brackets heart rate max minus resting heart rate, which gives us our heart rate reserve. So as well as that, we looked at the time, so how long the lesson should last. So it's 20 minutes plus for aerobic training. And then finally, we looked at the type, i.e. the method of training that we can use, which is continuous training and HIIT training, high intensity interval training. So what we're going to be doing in screencast is the actual adaptations that take place to our body systems with regards to training. So let's say we've trained for 12 weeks, 3 to 5 times per week. What changes does actually change with regards to our respiratory system, our cardiovascular system, and our musculoskeletal system? So these are the adaptations that we need to be looking at, and this is what we're going to be doing on this screencast. So first of all, adaptations to the respiratory system. So these are the adaptations that take place with regards to our respiratory system. The first one is we get strong respiratory muscles due to training. What functional effect does this have? So what does this effect have on the actual body when it comes to sport or comes to exercise? So again, increased mechanics of breathing due to having stronger muscles. This means we get an increase in maximal lung volume, such as tidal volume, minute ventilation, etc. And then finally, we get a decreased respiratory fatigue, i.e. the muscles, respiratory muscles that are working, they fatigue at a slower rate, so they're able to work for longer. What else do we get? We get an increased surface area of the alveoli. This means we get an increased gaseous exchange, so we're getting more oxygen into the bloodstream, therefore into the muscle. All of this leads to increased volume of oxygen diffused into the bloodstream, easier to perform exercise, reduces onset of fatigue, delays OBLA. Go on to what OBLA is in a few slides time. This is the important part. It reduces the onset of fatigue, so we're able to perform for longer, which is what we want when it comes to aerobic activities such as marathon, cycling, long distances. Increased intensity and duration of performance can reduce the symptoms of asthma as well if you're thinking about health issues within certain athletes. Okay, the adaptations to the cardiovascular system. First one, cardiac hypertrophy, i.e., as you can see here, the heart increases in size. So basically, you have a stronger contraction when it comes to each heartbeat, which means we get an increased stroke volume, i.e. the amount of blood leaving the heart per beat has increased. This increases our cardiac output as well. Also get increased filling capacity and force of ventricular contraction along with that. Another structural adaptation we get is an increased elasticity of arterial walls. Now, what does this mean? What does this imply? This is the main part. It increases the efficiency of vascular shunt. Remember, the vascular shunt is all to do with vasodilation and vasoconstriction. So again, increased vasoconstriction and dilation to distribute cardiac output. For example, during exercise, the blood vessels around the muscles vasodilate, the blood vessels around the vital organs vasoconstrict, more blood is going to the muscles, which means more oxygen is going to the muscles, which means we can perform for longer at higher intensities. We also get decreased resting blood pressure and increased blood pressure regulation due to increased elasticity of arterial walls. Continuing with the cardiovascular system, we also get an increased blood plasma. This means we get a decrease in blood viscosity, which aids blood flow and venous return. Venous return is very important when it comes to sport because we're getting more blood back to the heart, which means we're able to pump more blood with each beat when it comes to stroke volume. Increased number of red blood cells. We know that red blood cells carry hemoglobin. Our hemoglobin count also increases, which means we get an increase in oxygen carrying capacity, increase in gaseous exchange again. Capillarization surrounding the alveoli. And finally, we also get slow oxidative muscle fibers. We get an increase in slow oxidative muscle fibers. So increased surface area for blood flow. That's what capillarization is to do with. We get an increased gaseous exchange, decreased distance for diffusion. That's all to do with capillarization surrounding the alveoli within the lungs. What does this lead to? Increased blood flow and oxygen transport to the muscle cells, a decrease in blood pressure, ease to perform exercise, reduce the onset of fatigue and delays obla, again, same as before with the respiratory system, increase intensity and duration of performance, exactly the same as the respiratory system, lowers the risk of coronary heart disease, hypertension and stroke. And here you've got some information on stroke and coronary heart disease. You don't need to get that down, that's just something that you need to be aware of. Okay, we're going to go on to slow oxidative muscle fiber hypertrophy here when we're talking about the musculoskeletal system. So structural adaptations, we get larger slow oxidative muscle fibers. This means increase our potential for aerobic energy production, increase in strength, decrease energy cost, and decrease delay in fatigue. Well, there's delay in fatigue, sorry. So slow oxidative, remember that is the muscle fibers that we use for marathon running, cycling long distances, etc. What else happens to the musculoskeletal system? Increased size and density of mitochondria. So this is an increased utilization of oxygen, increased aerobic energy production. This is where energy production takes place within the mitochondria of the muscle. So that's where we actually get our energy production from. Increased stores of myoglobin. Remember, myoglobin is a protein that transports oxygen. So if we have more myoglobin, we've got an increased transport of oxygen to the mitochondria, which means we've got more oxygen for the muscle. Increased stores of glycogen. Glycogen we use as fuel, so increased aerobic energy fuels, increased duration of performance. And then we also get, with musculoskeletal system, we also get changes within the strength of connective tissue, thickness of articular cartilage, increased bone mineral density. Just get them down just so you're actually aware of them, but this is the important stuff when it comes to functional effects, these here. Finally, adaptations to our metabolic function. So again, increased activity of aerobic enzymes. Enzymes break down the things we use for fuels, so glycogen and fats, we use that for fuel. Enzymes break them down. So if we have an increased activity of these enzymes, it means we're going to get more energy released, okay, which is going to be beneficial when it comes to sport performance. If we look at all the adaptations we've just looked at, this is what happens. We get a net effect. We get increased VO2 max and delayed point of obla, which is the onset of blood lactate. This basically means the point in which blood lactate exceeds removal. So we get a delayed onset of this, which means we can perform for longer. Now, if you do want to take this further and stretch yourself a bit, you need to make sure you can split each one I've just spoken about into cardiovascular, respiratory, and the muscular and metabolic system. It's quite important because this could be the second part of a 10-mark synaptic question where you have to talk about the adaptations to aerobic training. So it's really important you make key vital notes on this and you get your questioning down to a T. Okay, thanks for that. Bye.